Hi, this is Julie Johnson with the Patient Safety Certificate Program pre-conference, and today I'd like to talk about engagement. Specifically, I'd like to talk about how you engage the organization, your colleagues, peers, and your staff in quality improvement. So what is engagement? Shook defined it as a positive cognitive, emotional, and behavior state directed toward organizational outcomes. In other words, employees feel connected to their organization and their work because they are part of something larger than themselves. To achieve successful engagement, leaders should appeal to their employees' minds, that's the cognitive aspect, appeal to their employees' hearts, that's the emotional aspect, and create an environment in which it is possible and easy to do the right thing, their behaviors. I'd like you to think about a time when you felt engaged at work. So often we think about the work that we're doing in quality improvement, and we think about how excited we are about our projects, and we go out to our colleagues and we can't imagine why they aren't as enthusiastic as we are. I know that's happened to me, and I imagine it's happened to you as well. And then one day I started to think, well, when was a time when I felt engaged? And when were my colleagues able to engage me and get me excited about their projects? So if you can think of a time, what is it that actually led to your engagement, and how do you foster that in other people when you're starting new projects? Butterworth talks about 9 reasons why people engage in change. Their values support it, they think the change will be worth it, they think it's important, they think it's possible, they think that they're ready for it, they believe that there's a need to make this change, there's a good plan and there's adequate support, they're reminded about the importance of it and there are adequate resources, and it's actually fun. I'd like to talk about some myths of engagement. Myth number 1 is showing the evidence is sufficient. Myth number 2 is everyone engages at the same time. Myth number 3 is that the same message works for everybody. Myth number 4 is that every intervention is equally easy to implement. We're going to talk about these one at a time, starting with the first one, showing that the evidence is sufficient. We know that simply showing the research evidence to support a change is not really enough to disseminate knowledge into everyday clinical practice. That's why we have these publications and we say, well, we have the evidence that shows change is necessary, but people still don't change their behavior. There's specific non-engaging methods, and that includes sharing medical literature passively, doing something just because it's required for accreditation or to meet regulations, and creating and disseminating a policy and doing nothing more. Those 3 things, none of them are adequate in engaging our colleagues. Myth number 2, everyone engages at the same time. If we expect that everyone will start moving in one desired direction at the same time, we're going to meet failure. Starting a change process with an entire department rather than individuals is not an effective way to drive change. Trying to get buy-in from everyone at once rather than focusing on the key early adopters is another way that won't engage our colleagues. Utilizing an early adopter who has little credibility has been ineffective in driving change. We know that we need champions who are respected in an organization to really drive those ideas and change processes. Trying too early to convince resistors to change. Those are all reasons why our change efforts are ineffective. Myth number 3, thinking that the same message works for everybody. Different people respond to different messages. You have to figure out your audience and what types of messages they'll respond to. Some people are looking for the what's in it for me. They want to see how it will be applicable to their duties and their responsibilities. Some of our colleagues are very people-oriented. They share a strong concern for others and their feelings. So you have to find the message that appeals to the people-oriented colleagues. Some of our colleagues are very content-oriented. They're interested in what is said rather than who is saying it, and they want to validate expertise and truthfulness. Others are very action-oriented. They focus on what will be done, how, when, and by whom. And some are time-oriented. They have their eyes constantly on the clock. They organize their schedules to allocate time for listening. Failing to customize the message to the audience will lower the chance of engagement. Non-engaging methods include not vetting the messenger, assuming only people with titles can communicate, not thinking that everyone has a role in sharing the message, using only email to get the word out, saying that I told them to make this change and then expecting people to follow through, and then using the same words and talking points for change toward everyone. Myth number 4, thinking that every intervention is equally easy to implement. Everett Rogers identified characteristics of an innovation that are most likely to lead to successful adoption: relative advantage, complexity, observability, compatibility, and trialability. Those are important characteristics to keep in mind. Methods of implementation that do not engage are attempting an intervention with the most challenging patients, for example, developing a rigid work plan that's limited by prior experience, implementing multiple change projects simultaneously, and using the same strategy on multiple projects. 4 rules of engagement are: connect to the core, engage the engaged, customize communication to support engagement, and segment and align. We're going to go through each of these individually. Rule number 1, connect to the core. Successful methods to engage by connecting to the core are to describe how a project fits into the bigger picture. For example, the organizational mission. Align the project with an employee's professional identity. Show how staff contributions have positively impacted the project or made a difference. Rule number 2, engage the engaged. Successful methods to engage the engaged are to seek champions who are opinion leaders. Now, you have to keep in mind that they may not have a formal title, but they can still be opinion leaders and champions of your project. Start a project on a small scale with a few key participants. Show that it can be effective. Include others after the early adopters have worked out all the bugs. Use early adopter peers to spread the word. Rule number 3, customize communication to support engagement. Different types of messages demonstrate different degrees of effectiveness in shaping behavior and promoting change. Now, this graphic shows you some examples of communication types. If you want to shape behavior, look at the ideas on the right-hand side of the graphic. Face-to-face is very important. One-to-one mentoring, shadowing. On the other hand, sharing information is at the other end of the spectrum, and you would be sharing information with flyers or newsletters, videos, articles, posters. So these are all important ways to communicate, but they're going to have different effects, and they're going to reach people differently. Rule number 4, segment and align. Successful methods to segment and align include developing an organizational goal and enlisting the participation of all levels, rolling out a project in an area that's most likely to be successful, and then adapt implementation approaches for each segmented group while aligning the common goals and objectives. So I'd like for you to take time to think about an improvement project that you're part of now or something that you're designing and that you want to implement in your own institution. So what will be the engagement strategy that you will use? I think it's just as important to think about the engagement strategy as it is about your PDSA cycles or the steps that you're going to use to implement the project. So how are you going to engage the frontline staff and the mid-level management, the physician leadership, the board of directors, the patients and the families? Each of those will need a different strategy, and I think it's important that you start to map those out with some of the tools and the ideas that we discussed. For this presentation on engagement, I used some very important resources that I'm going to highlight to you here. I think you should especially check out the implementation guide, a how-to guide for improvement that's from the AHA, HRAT, HEN Partnership for Patients, Implementation Guide Part 1. Thank you for your time, and I look forward to seeing you in September.